So welcome. Thank you so much for your interest. Today it's great to have an exchange of views with a very strong guest. He is Professor Weidinger, the president of the European Society of Cardiology. And it's great to have you here in Brussels in the European Parliament. You know, my political family, the European People's Party, we push since years for upgrading health on European level, to see this area as a European issue. A lot of people see health as a main issue for their life, in their daily life. And that's why to show that Europe can be of added value for the developments. Yeah? That is what we are pushing a lot. And probably people also know that we were pushing in this mandate mainly for a cancer plan, for fight against cancer, for the dream that we can beat cancer. And we achieved a lot with a lot of additional money, research money for doing this. And now we have further ideas in mind. And I thank you for your initiative to push for further diseases. And I don't want to say too much because you are the expert. So may I invite you to give us a little bit an idea about your background, about your work, and what you see as European issues there.
Thank you very much for the opportunity to speak to you. I'm interventional cardiologist in Vienna, and as president of the ESC, I really value this opportunity to speak on cardiovascular disease today. So important improvements have undoubtedly been made in the treatment of cardiovascular diseases. However, it appears that we are letting our citizens down a bit when it comes to improving cardiovascular health, and that is often compounded when we factor in gender, geography, and generation, where large disparities persist. As an example for this, over the course of a life of a woman, she is twice as likely to die of cardiovascular disease than of all types of cancer. However, in the public opinion, women are considered to be at lower risk of cardiovascular disease.
So already to inform and to give a proper assessment about the state of play and the challenges is already one important step on European level to get this.
We also say that cardiovascular disease doesn't respect borders, but in which country you live may have a great impact. There are large disparities in the cardiovascular death rates between high and middle income countries in the EU. So, for example, cardiovascular death rate can be 20% in high income countries and as high as 65% in lower income countries in the EU. So cardiovascular diseases not only represents the biggest killer in Europe and globally, but also markedly contribute to the high healthcare costs in Europe, because we know that 60 million people have to live with cardiovascular disease in Europe, and millions of new cases add every year to this huge burden of disease.
As European People's Party, you know, one of the main things for us is that there cannot be a first and second class European in our European Union. So that's why what you say about the different level of treatment and of chances to survive and to live is for us one of the things where we need a European initiative, where we have to make clear that there are no first and second class Europeans. In one aspect, in the last 5 years we made it. It was about the corona vaccine. There we produced corona vaccines where everybody was asking for such a vaccine. We gave to the Bulgarians, to the Czech, to the Spaniards, to the Finnish friends in the same moment of time. And that was, I think, a great message from Europe, that we treat everyone in the same way. And in your field, you say that the difference and the different kind of treatment and the chance to survive is so different. So that's why it's a high priority to work here.
Exactly.
Is this more about giving all doctors, all experts the same level of knowledge? Is this about informing them about the best possible treatment? Is this a problem? Or is this a money problem in a way that they don't have the resources to do a proper treatment? How would you describe this challenge?
Despite the availability of improved diagnostic modalities for early detection of cardiovascular disease, we have no efficient systems in place across the European Union which enforce identification and early management of disease. This often means that doctors, rather than dealing with prevention and early detection of disease, have to deal with advanced chronic conditions in continuously overburdened hospital systems. So when patients are discharged from hospital care, they often find themselves a bit alone for the appropriate access to rehabilitation to regain a full active life. And we as physicians are not in the position to offer suitable treatment options for end-stage heart disease and care facilities for patients with distressing symptoms at the end of their life. Robust data are needed to assess quality of care and to identify unmet needs. Yet we have a lack of high-quality disease registries that are publicly funded in the EU. So we are largely reliant on the private sector for data needed to assess how we treat patients in Europe. So obstacles abound, but they are indicative of the broader problem, which is that cardiovascular health is simply not paid attention enough and neglected in policy and allocated budgets today.
That's why it's good to have you here and to push for it. That's great. And we also see that as a policymaker, I can also feel that there are good initiatives there are good ideas there. So it's worth to invest in this and to do something there in this field. And if we can tell people that with European engagement, we can do something very concrete for your daily life, to make your life, even as a patient, better, and your chance to survive and have a better life is increasing. So that is what we as policymakers want to do every day. So, and again, I'm happy that EPP is driving this health issue. We fight also for a health committee in the European Parliament to upgrade this issue, that people know that this is close to our heart. You spoke about some elements. Can you give also, probably also finally on this more research perspective? You spoke about medicine, about this. Can you, because it's very practical, Europe has a lot of funds for financing of research and so on. There, everybody understands the European value, and the university European-wide are working together to develop and do innovation there. So give me a little bit of an assessment about where are we? Why is there not so much, let me say, innovation being present? And what can we do? What can we do in European now?
As I said, we definitely need more funding, public funding for cardiovascular research, and any meaningful action in cardiovascular disease would need to concentrate more on primary prevention and early detection of disease, such as a joint cardiovascular and diabetes health check, for example. Also, improvement is needed in precision of medicine with the help of new digital tools, artificial intelligence, and personalized care, which enables us to really reach the individual patient. This is the modern direction that we're aiming at, but which needs really direct public funding. Also, we need to enforce basic and translational research, because it is only with high quality research that we will be able to improve our understanding of disease mechanisms, to identify new treatment options, and also to offer the best therapies for the many patients with cardiovascular disease.
Perfect. Probably, Professor Weidinger, at the end, can you give us finally again an overview when we speak about cardiovascular diseases? What is the impact on our societies today? So how huge is thing? You compare it with cancer, that is very popular in the debate and so on.
Yes.
Can you give us again what does this in reality mean in our European societies, this disease?
Both cancer and cardiovascular disease have to be addressed by policymakers and the public, no doubt. But cardiovascular disease still remains the #1 killer in the world. That's a fact that should be addressed in the public. So I think we need a joint commitment to address this and to raise the awareness and give cardiovascular disease the attention that is proportional to the threat that it represents to the people in the EU today. We ask no more than this, but our patients certainly deserve no less.
Great message. And I'm happy that I can announce today, as leader of the EPP Group in the European Parliament, that after we managed the cancer plan in this mandate, we promised this. Now we are promising a plan against the cardiovascular diseases in Europe for the next mandate. That is what we already voted on as EPP Group, as the biggest group in the European Parliament. So to give full support for the initiative of the experts who give us an idea about the importance, killer number one, and give us also an idea about the solutions, about making the life of our citizens better and help the patients. So that is what we want to do. So you can count on EPP that we are the party of health in Europe, and we will push for further initiatives to strengthen the health initiatives on European level. Professor Weidinger, thank you so much for this. And probably at the end, we can also say in German, Dankeschön and vielen herzlichen Dank. You're from Austria, I'm from Bavaria, so that's why it's easy to say it in this way. Thank you so much for your interest and also for your presence here.
Let me add, on behalf of the 100,000 members of the ESC and the entire cardiovascular community, we would like to thank you. And you can count on the expertise of the ESC and our partners to help make this achieve.
Great. Thank you so much.
Thank you.
We will achieve it. Bye-bye.